This is a 54-year-old patient who was diagnosed by her neurologist with Tourette's syndrome 17 years ago. Notice the excessive facial movements which are involuntary around her mouth and the constant eye blinking. She also constantly touches her scalp and face as we continue this examination.
Then my nose and my eyes twisting, and I have a really bad problem with scraping my teeth and biting my tongue, twisting, and it just gets so much, you know, that it's just, and I have to just almost shake it off, you know, because it's, you know, only seems to be getting worse. When I saw that on YouTube, and I recognized the signs and symptoms right away. When I saw that, you know, just that mirror sticks, and then he made that lower jaw thing, I thought, yeah, it's time. 54 years is long enough. So.
Okay. Andre, do you have the numbers? Okay. We're going to insert 3 tongue blades.
We are inserting 3 tongue blades to increase the distance between her upper and lower jaws. Notice that her movements diminish greatly. This gives us an indication that our treatment will be able to help this patient.
So it feels better with those in?
Uh-huh. Like an opening. I can control.
Go ahead, take them out again.
I feel like there's this, you know, like gives me something, I don't know, like it's opening up my whole face, or my whole head. And like, you know, there's something I can control by biting. I actually feel like I could smile.
Notice how her involuntary facial movements decrease when we increase the spacing between her upper and lower jaws, and resume again when we remove these tongue blades, and then diminish a third time when we insert the tongue blades. We can vary the number of these tongue blades and determine the exact height this patient will need for treatment prior to fabricating an appliance. This is the patient 3 days later on the day we are going to deliver her appliance. We have a little more time, and she further explains her symptoms and impairments. Notice that she points to her left and right TM joints and describes pain. Most of these patients are truly internally deranged TMJ patients, and the dyskinesia symptoms and Tourette's movements are secondary to the TMJ internal derangements. Tell us about this movement problem in your face. What is it that is your main concern?
Is it moves all the time. And the clenching of the teeth and the eyes.
The blinking?
Yeah, and the blinking, except in the song that I have to blink. There's a song that we blink.
Tongue movement?
Tongue movement, and like the first 2 weeks of school, you know, this year I noticed, you know, as I was using, I noticed the pain, right? I was really been noticing the connection between ear pain and this.
Okay.
And all of a sudden it's like, it'd be like I go all day, all of a sudden I get this pain.
Okay. Okay, good.
And it, I mean, sharp pain
In
right
your ear.
there.
Okay.
Yeah, in that joint right here, and connected to the ear. The jawbone is connected to the ear bone.
Right.
Kind of thing.
Okay. Well, today we're going to give you your appliance that we've had made for you. We took the impression last time, and we're going to put that in for you today and see if it stops the majority of that facial movement. Okay, just fight down. Okay, good. Okay. Now, is that hurting you in any way?
No.
Feel good?
Feels different.
Different, okay.
It's interesting, I was thinking back about the smile. I've always had difficulty, taking a picture. They'd say smile once, and I'd have difficulty smiling.
Okay.
And it's easier actually to smile with this.
Well, that's good.
I can actually show my teeth. And my daughter noticed that after her orthodontic treatment, it's easier for her to smile in a picture. And not the prettiest, because I drink coffee, but I can show my teeth.
Yeah.
And I've never really could show my teeth in a smile, and it's always been really, I walk around, people think, well, smile. I thought I was, and maybe I'm not.
Yeah. I'd let the patient sit here for about 5 minutes with the appliance in their mouth, and there's still a little residual facial movement. So I'm trying to determine to what degree I should increase it further in height. I've placed soft acrylic on her splint and have had her glued on 3 tongue blades. Open. Now I'm taking it out of the mouth. Put your head back a little bit. And you can see the fresh acrylic added to the old acrylic of the splint. Are you getting it?
Yep.
Okay. This is the patient after the appliance
I can smile.
has been increased, the 3 tongue blades in height, and the patient has had it in her mouth for about 5 minutes, no longer. Okay, tell the audience how you feel about it.
Well, I can smile. I feel like my eyes are opening up a little bit. I know everything's not going to go away at one time, but my tongue feels higher. My throat feels open, more open. And I'm just kind of excited to go on the next 3 weeks to see how everything goes. And I'm anxious to not bite my cheeks so much, because I always bite my cheeks. I always have sores on my tongue where I bite my tongue, and I don't want to have those sores anymore.
The patient on her 1-week visit. She received her appliance a week ago and has been wearing it for the past 7 days. And I want you to tell the audience what you've noticed, what improvements or changes have occurred in the last week.
Well, not all my eye ticks were gone, but there was no more pain right here in the jaw joint. I wasn't biting my tongue anymore or biting my cheeks. I was unable to do that. So there's no pain there, and not biting the cheeks and tongue. That's been a whole lot better. Also, I'm a little bit slower now, but more specific with my speech. Even when I'm reading or singing with the children, I'm not touching my nose as much, which was one of my tics. I'm also able to, I have hardwood floors in my house, and before, when I would walk barefoot in the house, I was generally doing the toe heel walk. I noticed one night, after I finished watching the DVDs, I actually noticed I was walking kind of heel toe, and it wasn't as painful. Total street problems aren't there enough yet, but been more beneficial than not beneficial. And I'm also eating slower and taking smaller bites. I'm realizing that, no, I shouldn't have that really crunchy stuff. I should cut things up into small pieces, and that's helping too. The feet thing really gets me because I really wasn't able to walk barefoot in my house. Just walking around, it hurt, and it's getting easier.